Welcome to the return to SIUE COVID-19 training. Throughout this training, we will provide basic information about COVID-19 or the coronavirus, steps that the SIUE campus is taking and expecting of members of our Cougar community, what every Cougar can do to help keep our campus safe, and what community members should do if they develop COVID-related symptoms, have a close contact exposure, or COVID-19 diagnosed as presumptive or confirmed positive. So what is coronavirus? A novel coronavirus is a new coronavirus that has not been previously identified. The virus causing coronavirus disease 2019 or COVID-19 is not the same as the coronaviruses that commonly circulate among humans and cause mild illness like the common cold. The new name of this disease is coronavirus disease 2019, abbreviated as COVID-19. In COVID-19, CO stands for corona, VI for virus, and D for disease. Formerly, this disease was referred to as 2019 novel coronavirus or 2019 nCoV. There are many types of human coronaviruses, including some that commonly cause mild upper respiratory tract illnesses. COVID-19 is a new disease caused by a novel or new coronavirus that has not been previously seen in humans. Symptoms of coronavirus include cough, fever, chills, muscle pain, shortness of breath or difficulty breathing, sore throat, and new loss of taste or smell. Know how it spreads and help stop the spread of germs. There is currently no vaccine to prevent coronavirus disease 2019 or COVID-19. The best way to prevent illness is to avoid being exposed to this virus. The virus is thought to spread mainly from person to person, between people who are in close contact with one another, within approximately 6 feet, through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby, or possibly be inhaled into the lungs, or by contaminated hands touching your eyes. Some recent studies have suggested that COVID-19 may be spread by people who are not showing symptoms. Help prevent the spread. Stay at least 6 feet apart. Cover your cough or sneeze with a tissue, then throw it away and wash your hands. When in public, wear a cloth face covering over your nose and mouth. Do not touch your eyes, nose, and mouth. Clean and disinfect frequently touched objects and surfaces. Stay home when you are sick, except to get medical care. Wash your hands often with soap and water for at least 20 seconds.
We have missed our students, faculty, and staff, and the amazing community that we have here at SIUE. We are overjoyed to welcome back our students. However, your health and safety are our top priority, so we need every single Cougar to do their part. We need to keep each other safe. We need to make good choices. To have a successful and safe semester, it is critical that all Cougars make good decisions and follow the 3 W's. Wear a mask, wash your hands, watch your distance, stay 6 feet apart. The university provides a hub of coronavirus-related information, including campus policies and guidelines, coronavirus-related announcements, links to resources, frequently asked questions, an online form students can use to report COVID-related illness or exposure, instructions for faculty, staff, and students experiencing coronavirus symptoms but who have not yet been tested, those with close contact exposures, and those who have been diagnosed as presumptive or confirmed positive. The website is updated regularly, so please refer to it often. We will rely on each and every member of our Cougar community to help our campus stay safe and follow the guidance and expectations outlined in the State of Illinois' Restore Illinois Plan. The first way that you can help is by doing your part and standing 6 feet apart from others, both indoors and outdoors. To practice social or physical distancing, stay at least 6 feet, about 2 arms length, from other people. Avoid close contact with people who are sick, even inside your home. If possible, maintain 6 feet between the person who is sick and other household members. Put distance between yourself and other people outside of your home. Remember that some people without symptoms may be able to spread the virus. Keeping distance from others is especially important for people who are at higher risk of getting very sick. When you enter many campus buildings, you will see floor markers like these or similar in common line queue areas. Please do your part by following social distancing expectations and standing 6 feet apart. In some cases, we may also have occupancy capacities in certain spaces, like dining areas, the Cougar store, campus recreation, and other offices or common areas. Please follow the direction of SIUE officials who may provide additional information to help maintain social distancing and comply with the requirements of the Restore Illinois Plan. The Return to SIUE plan has set the following guidelines for face masks and face coverings on campus. Face coverings are a critical part of the strategy to help stop the spread of the coronavirus. Wearing a face covering helps you protect others. Face masks or face shields that cover the nose and mouth are required in indoor public spaces regardless of the ability to maintain social distance. Indoor public spaces include common spaces or community settings that anyone can access, such as reception areas with walk-in access, restrooms, hallways, classrooms, teaching and research laboratories, as well as common spaces in residence halls, conference rooms, lobbies, and break rooms. Face masks or face shields are required in outdoor spaces where 6 feet or more of physical distancing is difficult to reliably maintain. Disposable face coverings will be provided to departments to be used for students, employees, and visitors who forget their face mask. Students coming to campus may pick up one free mask provided by SIUE. Watch your email for information about pickup times and locations. Face coverings can be purchased at the Health Service Pharmacy in the Student Success Center or the Cougar store in the Muck on the Edwardsville campus. Before putting on a mask, clean hands with alcohol-based hand rub or soap and water. Cover mouth and nose with the mask and make sure there are no gaps between your face and the mask. Avoid touching the mask while using it. If you do, clean your hands with alcohol-based hand rub or soap and water. They should be routinely washed depending on the frequency of use. Individuals should be careful not to touch their eyes, nose, and mouth when removing their cloth face covering and wash hands immediately after removing. While having face coverings is important, wearing them properly is critical. In order to wear your face covering correctly, wash your hands before putting on your face covering. Put it over your nose and mouth and secure it under your chin. Try to fit it snugly against the sides of your face. Make sure you can breathe easily. Do not place a mask on a child younger than 2. Face coverings are critical to help protect others. Wear cloth face coverings in public settings and around people who don't live in your household, especially when social distancing measures are difficult to maintain. Don't put the covering around your neck or up on your forehead. Don't touch the face covering. If you do, clean your hands. When you're home or in a personal space, remove your cloth face covering carefully. Untie strings behind your head or stretch the ear loops. Handle only by the ear loops or ties. Fold outside corners together. Place covering in the washing machine. Wash your hands with soap and water. Do not wear a used, unclean face covering for multiple days. Face coverings are not required in the following limited circumstances. When working alone in a single office workspace when 6 feet distance can be maintained. When in individual residential living units. When engaging in physical exercising, showering, or using locker room facilities. When doing so poses a safety or security risk. While operating outdoor equipment, if not appropriate from a safety standpoint. when consuming food or drink, when engaging in personal hygiene activities. Okay, Cougars, think of your favorite 20-second song verse and get to washing. Some favorites include one round of the ABC song, the chorus to Lizzo's Truth Hurts, Prince's Raspberry Beret, or Dolly Parton's Jolene. Keeping hands clean is one of the most important steps we can take to avoid getting sick and spreading germs to others. Many diseases and conditions are spread by not washing hands with soap and clean running water. The CDC recommends cleaning hands in a specific way to avoid getting sick and spreading germs to others. Step 1. Wet hands. Wet your hands and apply enough liquid soap to create a good lather. Step 2. Rub palms together. 3. Rub the back of hands. 4. Interlink your fingers. 5. Cup your fingers. Step 6. Clean the thumbs. Step 7. Rub palms with your fingers. Scrub your hands for at least 20 seconds. Dry your hands using a clean towel or air dry them. Remember, if you cannot wash with soap, use a hand sanitizer with more than 60% alcohol content. SIUE Facilities Management is doing their part to help too. Classrooms, offices, and public areas are getting some extra love. In many areas, disinfecting wipes are being made available for the campus community to use as well. Your help disinfecting high-touch areas in between uses is important. Offices and public areas. Offices are cleaned and disinfected weekly. Public areas are disinfected multiple times daily. Vending machines are disinfected multiple times daily. Foggers and sprayers used as needed. Restrooms and classrooms. Restrooms are cleaned daily. Restrooms are disinfected twice daily. Classrooms are disinfected nightly. Special attention is being paid to desk and high-touch areas. Special care when using foggers or sprayers. To help keep yourself and the SIUE community safe, we recommend the following health and safety items as your tools for staying safe. Personal items to have available. Multiple face coverings, cleaned regularly. Hand sanitizer, thermometer, hand soap, hand wipes. Household items to have available. Cleaning disinfectant wipes, dish soap, laundry soap, disposable utensils and plates, household cleaners.
It is critical that community members who are feeling sick, have had a close contact exposure, or are presumptive or positive cases take care of themselves and their community. The most important thing you can do to help keep your community safe is to stay home when you're feeling sick. Most people have mild illness and are able to recover at home. If you think you may have been exposed to COVID-19, contact your healthcare provider. If you experience emergency warning signs like trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, or blush lips or face, seek immediate medical care. If you are feeling sick with COVID-related symptoms without emergency warning signs, follow these steps. Stay home. Stay away from others. Stay home. Most people with COVID-19 have mild illness and can recover at home without medical care. Do not leave your home except to get medical care. Do not visit public areas. Take care of yourself. Get rest and stay hydrated. Take over-the-counter medicines, such as acetaminophen, to help you feel better. Stay in touch with SIUE Health Service for students or your healthcare provider. Call before you get medical care. Be sure to get care if you have trouble breathing or have any other emergency warning signs, or if you think it is an emergency. Avoid public transportation, ride sharing, or taxis. If you're experiencing COVID-related symptoms and need to seek medical attention, be sure to notify your doctor or SIUE Health Service before you arrive. This will allow them to take the right steps to protect themselves and other patients. If you're having a medical emergency, be sure to notify dispatch personnel so emergency medical services personnel are prepared. If you think or know you had COVID-19 and had symptoms, you can be with others after at least 10 days since symptoms first appeared, and at least 24 hours with no fever without fever-reducing medication, and symptoms have improved. Depending on your healthcare provider's advice and ability of testing, you might get tested to see if you still have COVID-19. If you are tested, you can be around others when you have no fever, respiratory symptoms have improved, and you receive 2 negative test results in a row, at least 24 hours apart. If you tested positive for COVID-19 but had no symptoms, if you continue to have no symptoms, you can be with others after 10 days have passed since test. Depending on your healthcare provider's advice and availability of testing, you might get tested to see if you still have COVID-19. If you will be tested, you can be around others after you receive 2 negative tests results in a row, at least 24 hours apart. If you develop symptoms after testing positive, follow the guidance above for I think or know I had COVID and I had symptoms. For those feeling ill with COVID-related symptoms but have no known exposure, currently, anyone with symptoms of COVID-19 is encouraged to be tested. If you do not have a high-risk condition and your symptoms are mild, you can call your healthcare provider to help you decide if you need to be further evaluated. There are testing locations listed on the Illinois Department of Public Health website with information and requirements for testing at each site. You can find this information at http://dph.illinois.gov/testing. If you are over the age of 60 years, are pregnant, or have medical conditions such as cancer, immunosuppression, heart, lung, or kidney disease, and diabetes, you may be at a higher risk of COVID-19 complications. Call your medical provider or SIUE Health Service for students and ask if you need to be evaluated. They may want to monitor your health more closely. A potential exposure means that you generally need to be in close contact with a person with COVID-19 to get infected. Close contact includes living in the same household as a person with COVID-19, caring for a person with COVID-19, being within 6 feet of a person with COVID-19 for more than a few minutes, or being in direct contact with secretions from a person with COVID-19. For an example, being coughed on, kissing, sharing utensils, etc. Being in close contact is described above in the 48 hours before a person with COVID-19 developed symptoms. If you have not been in close contact with a person who you know had COVID-19, you are considered to be at low but not zero risk for infection. Cases of COVID-19 do occur due to community spread from people you may not know have COVID-19. That is why hand hygiene and social distancing are important prevention measures. If you have been exposed to a person with COVID-19 but not in close contact, you can continue to go to work and school, but should monitor your health for the 14 days and stay away from others if you get sick. If you have had a close contact exposure to someone with COVID-19 while they were ill, but you were not sick, you should monitor your health for any symptoms of COVID-19, including fever, cough, new loss of sense of smell or taste, headache, muscle pain, sore throat, or shortness of breath for 14 days after the last day you were in close contact with a sick person with COVID-19. You should not go to work or school and should avoid public places for 14 days. You may be contacted for a public health interview. If you have had a close contact exposure to someone with COVID-19 while they were ill and you get sick, currently anyone with COVID-19 symptoms is encouraged to be tested. COVID-19 testing sites can be found on the IDPH website at http://dph.illinois.gov/testing. If you are over the age of 60 years, are pregnant, or have medical conditions, you may be at a higher risk of COVID-19 complications. Contact your physician's office and tell them that you were exposed to someone with COVID-19. They may want to monitor your health more closely. If you do not have a higher risk condition but want medical advice, call your healthcare provider and tell them that you were exposed to someone with COVID-19. If you have a confirmed or presumptive positive COVID-19 test, manage your symptoms, take care of yourself, get rest and stay hydrated. You can take over-the-counter medicines such as acetaminophen to help you feel better. Stay home except to get medical care. You should restrict activities outside of your home except for getting medical care. Do not go to work, school, or public areas. Avoid using public transportation, ride sharing, or taxis. Separate yourself from other people and animals in your home. As much as possible, you should stay in a specific room and away from other people in your home. Also, you should use a separate bathroom if available. Additional guidance for persons who are helping to take care of you at home is available. People with COVID-19 symptoms and a positive test who have stayed home isolated, can leave home under the following conditions. If you have not had a test to determine if you are still contagious, you can leave home after these 3 things have happened. You have not had a fever for at least 72 hours. That is 3 full days of no fever without the use of medicine that reduces fevers. And other symptoms have improved. For example, when your cough or shortness of breath have improved. And at least 10 days have passed since your symptoms first appeared. The differences between quarantine and isolation can often be confusing, and the terms are often used interchangeably. They do mean something very different. Quarantine keeps someone who is in close contact with someone who has COVID-19 away from others. Isolation keeps someone who is sick or tested positive for COVID-19 without symptoms away from others, even in their own home. If you had close contact with a person who has COVID-19, stay home until 14 days after your last contact. Check your temperature twice a day and watch for symptoms of COVID-19. If possible, stay away from people who are at higher risk for getting very sick from COVID-19. If you are sick and think or know you have COVID-19, stay home until after 3 days with no fever and symptoms have improved and 10 days have passed since symptoms first appeared. If you tested positive for COVID-19 but do not have symptoms, stay home until after 10 days have passed since your positive test. If you live with others, stay in a specific sick room or area and away from other people or animals, including pets. Use separate bathrooms if available.
There are some key steps students, faculty, and staff will need to take as members of the SIUE community. Following these directions, also located on the siue.edu/coronavirus website, will help us keep the campus safe. It is important to inform SIUE if you are experiencing a COVID-related health concern. For SIUE students who experience COVID-related symptoms but have not yet tested positive, have had a close contact exposure, or have been diagnosed as presumptive or confirmed positive COVID case, please do the following. Stay home. Do not come to campus at any time for any reason. Students living in university housing should not leave their personal living space. Stop the spread. Contact your health provider or SIUE Health Service at cougarcare@siue.edu or 618-650-2842 to report any symptoms. Health Service will provide follow-up. Be prepared to provide the date you first began to have symptoms of COVID-19, when you were last physically at campus, and the date that you were tested and received your results, if applicable. Continue participating in virtual coursework if feeling up to it. Notify faculty in face-to-face courses that you are unable to attend. Refer to the directions for student employees if holding on-campus employment. Follow the direction of health provider, SIUE Health Service, and Madison County or other applicable health department. You may return to campus when released by a healthcare provider with accompanying documentation. No student should return to campus until at least 72 hours have passed without medicinal intervention. Residential students who need to quarantine or isolate in their residential living space may not leave that space to access any other parts of campus until released by a healthcare provider with accompanying documentation. No student should leave their residential space until at least 72 hours have passed without medicinal intervention. Your identity will not be disclosed to anyone other than SIUE employees responsible for maintaining your health and safety, or health department officials as required. You may voluntarily share your information with whomever you choose. Health Service will notify the Dean of Students for absence notification to instructors. Instructors will be asked to extend grace and work with students for alternative assignments. Students and employees will be directed to self-quarantine or isolate by the appropriate medical authority, likely a public health department official. Health Service will notify university housing if the student lives on campus. For SIUE employees who experience COVID-related symptoms but have not yet tested positive, have had a close contact exposure, or have been diagnosed as presumptive or confirmed positive COVID case, please do the following. Stay home. Do not come to campus at any time for any reason. Stop the spread. Contact your health provider to report symptoms. Contact department chair, director, or manager to inform of your absence. Contact Human Resources, Summer Murphy at extension 2124 or Bob Tumith at extension 2102. Be prepared to provide the date you first began to have symptoms of COVID-19, when you last were physically at work, and the date that you were tested and received your results, if applicable. Discuss with the department chair or director whether participating in virtual work is an option and whether you feel up to it. Discuss with Human Resources university benefits that may be available to access related to paid time off. Follow the direction of your health provider, SIUE Human Resources, and Madison County or other applicable health department. You may return to campus when released by a healthcare provider with accompanying documentation. No employee should return to work until at least 72 hours have passed without medicinal intervention. Your identity will not be disclosed to coworkers unless necessary for contact tracing purposes. This information will remain confidential. You may voluntarily share your information with whomever you choose. Understanding your role in keeping the SIUE campus, local area, state, nation, and world healthy is critical. SIUE has worked hard to implement guidelines, expectations, procedures, and policies to keep us all safe. We want our community to thrive, our institution to remain open, and our students and employees to remain healthy. It's important that students, faculty, and staff comply with the guidelines, expectations, procedures, and policies that have been established, and with the people-focused health and safety policy. Familiarize yourself with the policy and do your part. The Dean of Students and Human Resources will be the entities responsible for formally holding students, faculty, and staff accountable for violations. The following resources were used to help develop our Return to SIUE plan and this training. For more information about the coronavirus, how to help stop the spread, things to help keep your community safe, and Illinois guidelines and requirements, feel free to visit their websites. All SIUE students, faculty, and staff should visit the siue.edu/coronavirus site to familiarize themselves with campus expectations, guidelines, and procedures, your roles and responsibilities, and the state of Illinois guidelines. We hope to see you around campus, masks on, 6 feet apart, and washing and hand sanitizing your hands frequently.